Hi everyone, good evening. One second. All right. So how are you all doing tonight? I'm not sure if you guys are able to chat. I think you should be able to chat now. All right. So how's everyone doing? Great. Okay. I'm doing good. I hope you all had a great weekend. Um, because I'm great. We are doing great. Ma'am is doing great. Um, all right. So I believe by now all of you must have seen the blueprint, the new blueprint that CAPR has recently launched. And if you guys have any questions, note it down. But let me finish our presentation, and at the end we can have questions. All right. Okay. Do we have people who are decided that they are going to take the exam as per the new blueprint from 2026? Anyone yet? Yes. Okay. All right. So a lot of you guys who are answering, it's going to a different tab to host and panelist. So if you guys can go in the chat box where you're typing, just change the setting to everyone from host and panelist. So I don't miss anything that you guys are talking. Okay, great, thank you. So I see a lot of people did say that they want to take the exam as per the new blueprint, which is good if you have already made up your mind. Well, Pooja, we can discuss that, but I'll always recommend if you have everything ready, your credentialing is done, just take the exam as per this pattern. Yeah, and then I'll share the pattern with you guys and you guys can decide based on that. Okay, no worries, Zishan. I'll always recommend current pattern. And we can have a discussion on that. But if your credentialing is not done, if you have other things in line, then that's okay. We can go with the new pattern, okay? All right. Yogita, I can, I'll just have to go on Google and get that link. But if you go on Google and type CPTE or CAPR new blueprint, you'll just get it. Can you take it in November 2025? Yes, Krishna, it can be done. All right, let me finish. So I know a lot of students are new, so I'll quickly explain things briefly, and then we'll start talking about the new blueprint. Okay. Before that, I'm Ankit. I am an instructor in PCE StudyBuddy. I teach for the physical therapy license exam of Canada from it's been more than 10 years. We started in 2015. It's 2025. I'm getting old because I can see some old videos. I had more hair. My hairline has changed. So we have seen PCE from a long time, how PCE used to be. Back in the day, they used to ask like 30 questions on radial nerve and median nerve. And you can pass the exam. But then they were grilling students in the clinical portion. Then clinical portion was gone. Then this new pattern came in and exam scoring pattern changed. It used to be a very different scoring pattern. Now they came with similar to what NPT does. US exam does like 800 scoring pattern. Each province started conducting their own exam. CFPR failed many times to conduct clinical exam. That's why each province decided to do their exam. And finally, CAPR is taking the control back. because the provinces are getting tired, or they want to regulate things more, but they want to have same standard throughout Canada, right? Same standard means British Columbia and Alberta were conducting in-person exam. So the therapist standards for passing the exam was different. And then Ontario was doing verbal exam, which was much easier, clinical exam, which was much easier. So the students who failed Alberta or British Columbia, they'll take the Ontario exam and pass it, and then get the license transferred. So I think gradually they understood what's going on, and maybe that's why they decided to come up with this new pattern. But anyways, it doesn't matter. Whatever the pattern is, people will study, people will pass. You just need to be well prepared. You might have to spend more time in preparation. That's the only difference. And you might have to build up some internal skills of communication, of talking, explaining things. That was not needed earlier, but now it's needed, both on the same day. Okay. All right. Now we have a Q&A. If you guys want to throw your question there, so that if something comes to your mind, you want to throw your questions there, I can always go back and check in during the break. But let me give a brief idea. All right, so as you know, again, we'll briefly explain things, what's changing. So as you know, the current pattern has two portions, written and the clinical portion, which varies by province. Ontario has a different clinical exam, Alberta has a different one, and then British Columbia has a different one. Ontario was the easiest so far. Now the new pattern is going to one exam, which will be conducted by CAPR, not by each province. One exam means it will have both the same day, the written portion and the clinical portion, which is also the oral portion. So keep in mind, the oral portion is actually the clinical portion as per the new pattern. Written section will stay the same, oral section will be added, right? And cost, as you know, they have explained some cost, which we don't have to worry about that. We'll wait for that. Starts January 2026, and exam will be conducted 8 times a year, which we know that. And results timeline does not change. It will be the same 4 to 5 weeks for the results. Okay. But you have to pass both the written portion and the oral portion. If you fail any of that, you'll be repeating the whole exam as per the new pattern. Okay. Whether to take exam now or in future, if you have everything ready, if your credentialing is done, and you have started preparing, you have enough time to take the exam in September, October, November. You have enough time. Now the question is, after you take the exam in September, October, November, will you be able to take the exam for Ontario? That's one question. Or will you be able to take it, will you be able to work in some other provinces that don't conduct exams, like Saskatchewan or Nova Scotia? Probably yes. If you take it in this pattern, what Ontario explained in the recent webinar, that will continue to conduct OCE until there is a demand. Demand means the ones who are taking the exam this year. If you guys remember, during our last meeting, Ontario did not open the June exam date. But after that, they opened the June Ontario clinical exam, which has been getting full. I mean, it's not full completely, but there are candidates who are booking that exam. And Ontario said that they will continue it until the end of the year. So end of the year means probably October. Okay. So maybe one more. But they said that they will keep continuing working for that exam, or see if there is a demand, right? So even if you take the exam as per this pattern, current pattern, you'll still have the option to go for Ontario. Or if you're in those provinces, Nova Scotia or some of the smaller provinces that does not have exam, that consider your clinical hours, I'll recommend you guys can write an email to them. Probably they will release the same thing. Okay. It's not worth worrying about Alberta or British Columbia clinical exam because those exams are anyways very tough. So if you have to pick between Alberta or British Columbia in-person practical exam versus new pattern single exam, I'll say go with the new pattern single exam. Don't worry about Alberta or British Columbia clinical exam because they're quite tough. New pattern will be much easier, right? Anyway, so we can discuss those things at the end. I'm just going to start with the new pattern. Okay, let me explain this, and then we can have questions on that. I'll give you guys a chance to ask questions. Okay. Now you guys have seen this, must have seen this already. This is the written section, oral section. Written section 40%, oral section 60%, 100 questions, 150 questions. Now 100 questions, I assume they're not going to give you more than 2 hours. 2 hours of writing a written portion. Multiple choice question, same like how it is right now. And something that they have added is 20 to 25% of video or image questions. E-questions are electronic, either video or image questions, which has not been part of PCE so far, but that's a big change. And I knew that it's going to start someday because CAPR has been, I mean, they're getting a lot of training and they're working together with NPT, FSBPT, so they're changing a lot of things. So that will be new addition. 20 to 25% out of 100 questions means approximately 20 to 25 questions will have images out of 100. Well, we are already practicing those kind of questions in our class, at least the image question, not the video ones. We'll start the video ones too. But the only challenge with that will be you'll have to spend more time to understand the image or the video to answer those questions. So that's going to take time, right? Otherwise, I don't think difficulty will be too much. Now, this is the same thing, 80% Vignet style, 20% standalone, which is what they have been doing right now also. So out of 100 questions, 80 through Vignet, 20 questions will be via standalone, right? 20%. All right, now going to the oral section, which is 60% of your exam, 150 questions, structured cases. I'll show you guys some cases tonight. So structured case means the whole scenario case, like what Ontario does right now. They give you a case for their clinical exam. They give you a case. There are like a bunch of questions, 8, 10 questions. And each of those questions have to be answered in person. Questions are pretty standard. Like, do you think if this candidate is appropriate for physical therapy? Does he need physical therapy? How do we decide those things? Based on his needs. Is it musculoskeletal injury or is it systemic injury? If it's systemic, then he does not need physical therapy. He needs to see somebody else. Is it musculoskeletal injury? How do you know it's musculoskeletal? Based on the presentation. That's question 1. So that's how it goes. Here's the screen. All right. So let's start with this. Look at this, MSK, neuro, cardio, other stuff. Nothing has changed there. 50% will be MSK, neuro, which is still the same, cardio, other stuff. Still the same, 100% of the exam, but this includes 40% written, 60% oral. But I'll share those things also with you to help you understand things. But the scoring system, MSK was always this high, neuro, cardio, other system. So that's how the whole scoring system is. Okay. These things are also there. I think they have made it more concise, which is helpful. Diagnosis and assessment, care planning, safety part goes more to oral section. And I'll discuss with you guys what's part of safety. Professional responsibility, more oral. So how the current pattern is asking a hell lot of question on professional responsibilities. Now, most of those questions will go for the oral exam. This is a good thing. Collaboration, like collaborating with social worker, nurses, other people, most of them will go to oral section. Communication with PTA or other team members. So if you look at these areas, communication, collaboration, more ethical areas are going towards the oral section. Other areas, there's bigger chunk of written section. Right? Okay. So here's the new blueprint. They're like broken down. Best available evidence in clinical decision making. It was always there. Clinical decision making means if there is a patient with lateral epicondylitis, you're going to treat them. What's the best evidence? Evidence means research-based evidence, not what the textbook says. What's the most appropriate evidence? Based on the textbooks only, they cannot make question from a research paper, but from textbook only, what's the best available evidence? Does ultrasound work in this case or no? Right, so you have to, these are the core areas that you'll be tested on. Core, best available evidence. Client context in clinical decision making. Client context means like see a bigger picture. Somebody came to you for shoulder pain, also depressed, other things going on. So understand a bigger picture when you're making a decision of what to do next. Personal knowledge and experience. So these things are still part of the current pattern, but now they have made those things more clear upfront that what they're expecting, right? They've been working on this, so now they're making things more clear. Right. Now, assessment and diagnosis, you see, 30% written section, and 13% of this goes to oral section. Interview the client and get relevant information about health condition, personal and environmental factors. Do you guys understand what does it mean? So basically, when you're talking to client, getting information like SOAP notes, subjective information from the client, health condition, what's going on, personal and environmental factors. Environmental means where does he live, living condition, and those kind of questions are definitely part of. Like, what information would you like to collect from patient here? Why do I need to know how he lives or where he lives? If I'm going to treat his ankle sprain, why do I need to know about his environmental condition? Because you'll be discharging him. So the goals that you set will be based on his living condition. Okay, so now it's part of both. This area will have 30% from will be there in written section, like physiotherapy diagnosis, if determine if physiotherapy is indicated, prognosis, all of this 30% part of your written section, and 13% of this whole scenario will be in oral section, and most likely this or this goes in oral section. Yeah, because in oral section you have to understand a bigger picture. Right. Second is care planning. Will we get this type of question in written exam as well? Yes, you already get this kind of questions in written exam. It's already there. Now these are more goals, intervention plan. They're already part of. So the core physical therapy questions are big chunk for the written portion, which are already there. It's not new. Written portion already has these things. Client relevant information throughout the care. What does he need to know about his progress? What's the next plan? A whole plan of care, right? Actively involve client in clinical decision making. It's already there. We already do that, right? Right. So many of you are asking questions, and the questions are going to host in panelists, a different tab. So in your chat box, change it to everyone so I can see your questions. Okay. Modify intervention plan. So all of these are more core therapy, which are already there. It's already coming in the exam now. It will continue coming. But some of the questions will also be asked in oral section, right? Develop a discharge plan, transition of care plan, when to discharge. Transition of care means when a patient moves from hospital to nursing home or subacute care, back to home, and from home to outpatient clinical facility. So that's transition of care. How do we decide that? It's already there. I mean, we do discuss those things, but briefly it will come here too, right? Yeah, pretty much. No, they're just merging the exam, nothing new. Okay. Now again, client safety part. Now, if you see this, oral section is getting bigger. Client safety, right? Safety means what? Look at this. This is already part. They've been asking this autonomy, integrity, or the principles of ethics. Okay, those things will be asked more in oral section. So Ontario Clinical Exam has one category right now where they ask questions about ethical principles or ethical scenarios. Ethical scenarios means patient's insurance has denied more visits. Okay, what do? You only have 2 more visits left. So it needs plan. Only 2 more visits. So what principles of ethics are compromised? There are 4 principles, right? So you have to decide, is it a case of autonomy? It's not a case of autonomy. Beneficence, justice. Is it justice means being fair? Is it fair? Somebody who really needs therapy, but insurance denied. Ethically, it's unfair. But this, as per system, it's fair because insurance has already discussed with them that this is what you will get. But ethically, it seems like, oh, he should get more. Ethically, it seems unfair. Right? So that's part of ethics. Those questions get in other oral section, which we do discuss right now also in Ontario. So it won't be hard for us to just have some separate classes. No, we can discuss that. Give me 1 second. Let me finish this. Client safety and comfort. Back to safety and comfort. Not the core principles, but safety. Is he ready to be discharged? Does he need an extra care at home, caregiver at home? Whom should you involve? Emotional state. Not just physical, emotional. Emotional state means mental stress, depression, suicidal, those kind of things. This is already part of Ontario exam. Infection control, Some questions will be here, some will be here. So this area, safety will be, it's pretty much 50-50 divided in oral and written. Only thing is you'll have to work and practice explaining these things. Right? Adverse events. Adverse events means risk of fall or medications compromise, like medications being overlapped, those kind of things. Okay. Accessibility. Advocate for accessibility. Accessibility means a lot of people don't get physical therapy. So advocating for those things. Continuum of care. Continuum of care means sometimes the insurance company will say that no, Parkinson's patients are not making progress. Let's discontinue. But advocating why they should get, or why should the care be continued, the physical therapy care should be continued for these kind of individuals because their condition will decline. Even though they are not making progress, but physical therapy is going to make sure that their condition will not decline or should not decline if he continues physical therapy. Otherwise, there will be a significant drop due to lack of therapy. And he might start experiencing falls and other problems, and it might be more expensive for insurance later on, right? All right. Again, now professional responsibility, as you can see, this is going up. And then the next category, professional responsibility, that's a big chunk of oral section. Consent, comply with regulations, privacy, which we do in ethics. So those things are going more for oral section. They will be there. They'll be there. Conflict of interest. So you see this, what we have been doing for ethics, those things are moving more towards the oral section, which is good. You just have to practice verbalizing these things, and you should be okay. All right, now responsibility, and I think this is the last section that we can see. Again, collaboration part, it's pretty much 50-50, and communication is 5 and 12%. Okay. Situations that may benefit from collaborative care. Collaborative means should we involve occupational therapist, should we involve a speech therapist, involving some kind of nurse specialist for wound management, those kind of things. Negotiate shared and overlapping roles and responsibility, or same thing, more something that you call ethical. Those things are falling here. Pretty much 50-50, right? Supervision and education, supervising a PTA, sorry, or students. This category will be same for both. Now let's understand the communication part. Okay. Trust with the client. You guys understand what does it mean? Like actually making your client believe that you know things. They should trust you, and they should understand the treatment they are receiving, is it appropriate or not. Kind of explaining them, building trust with them, all those. So if you see those areas like trust, exchange of information, make sure that he's sharing all the details that should be shared. If they're being abused at home, they should be sharing those things. Comes here primarily. Look at this. Share information empathetically, which means don't be sympathetic, be empathetic. Okay, more caring. Not, oh, I feel sad for you. This is what can be done in this situation, like that. Okay. Be respectful. Should give you an idea like in what direction they are moving. Adjust the strategy with purpose and setting. If you're in a hospital setting, it's different communication with the nurse, nursing aide, and other caregivers, family members. When you're an outpatient, communication is different. Okay. Documentations and some technologies. Okay. All right. All right. So before I go there, let's see if you guys have any questions. Pooja, I believe you're a student of StudyBuddy. I mean, if you're a student, just ask in the group. Okay. Also, keep in mind, it's not very great to share the cell phone number like that, because you have to understand people when you when you make a study group, if it's a best fit. Otherwise, there will be a waste of time. All right, so another question. So, I mean, make cohort and practicing from now on, and planning to give exam next year. You can. I mean, if you, as I said, if you have the option, we can discuss like, is it really easy to explain things? Yeah, it's not easy to explain things. Why is it not easy? Because right now, students don't practice those things when they are preparing for the written part. They practice on what's the right answer. Based on this situation, I think this is the right answer. Now try explaining that. Okay, there's a case of abuse, child being abused at home. You know the answer, and I have to report. So what do you do? Try explaining things. Or if an elderly person, 70-year-old, being abused at home, his son-in-law pushed him. What are the steps? So that needs more practice, communication, and organization. Right. So far for the written part, you just need to know, all right, this is what happens, I report. You don't worry about explaining why you decided to report. Whom will you talk to first? Later. What if he denies, no, I don't want to report? Then what will be your steps? That needs more practice. Not that you don't know, but more practice. Okay. So if you have more time, that's always, it's fine. So if you start preparing from now on, it can be done, enough time. If you start preparing from now on, you have option to pass the exam before November also. This current exam needs 5 to 6 months, 5 months, 5 months max. Last 2 months, I'll say full-time study. It's very hard. If you're going to continue full-time work until the exam, then it's not happening. Last 2 months at least needs full-time studies, right? Right. Have we discussed already about the duration of the exam? The duration is going to be like 100 questions, 2 hours, right? 100 questions, 2 hours. They're not going to give you more than 2 hours for 100 questions. Written part only has 100 questions, right? And approximately, I assume 3 hours, okay, for the clinical portion. When the exam be held, it will be from January 2026, and they're going to conduct it 8 times a year. My plan was to take exam in September, but with all the changes, you got confused. Ask yourself, what are they confusing you? They haven't changed anything for the current pattern. Nothing has changed for the current pattern. If you are confused that, oh, maybe new pattern is easier, I'll have to study less. But let me break it down for you. If you guys are thinking that I'll have to study less for the written portion, new pattern will be easy, right? Take a look. Take a look at this musculoskeletal section. Current pattern and the new pattern. Tell me what has changed. Same scoring for both. Look at the topics. Everything, every single thing, nothing has changed. With the new pattern also, you will be studying same amount. Number of questions will be less. Doesn't mean the quantity that you need to finish has gone down. Exact same. Take a look at neuro. exact same, pretty much. Even the scoring. Some of it will be in written section, some of it will be in oral, or a combination of it in written and oral. But technically, you still have to understand this thoroughly. Those cases will be there. So there's no question of studying less, you'll be studying more. So don't get confused on those things. You have to study and you have to explain those things. All right. Let me see the questions. For that, I'll say talk to this province if there are any assurances. They cannot give any assurance. But I believe, as they said, things will continue. So we have to go with that. How much time? Well, I'll say written pattern still needs same amount because you have to be good with the written portion. And you have to be much better with the written portion now with the new print as per the compared to old one. In old one, you just need to know, you only had to know that's the case if there is impingement, strengthening of rotator cuff, right? What are the other possible scenarios in this? I don't have to worry about that. And you do not have to worry about explaining those things. Okay. With the new pattern, you have to be very thorough with things because if you saw the number of questions, there are 150 questions, all of them are case based. There will be a case and bunch of questions. So preparing for the written portion will be much easier if you understand the writing portion very well. Because writing, this is all, I mean, it's part of written and oral both. So if you understand the writing portion very well, like if patient has impingement, what would you do in the beginning? What would be a focus of treatment, intervention, first few weeks, second and third? Currently, those kind of questions will not come. As per the new pattern, you have to give home exercises. What are the home exercises? You have to know the home exercises that will focus specific muscles. So slightly more reading, but if you understand the written part very well, which we do teach in depth, and we will start adding those things probably from next cohort in the MSK section and cardio. We'll start adding those things, and then you just have to prepare, practice and practice more. You're going to have more instructors for the oral sections and more mentors separately. So written mentors will just focus on the written part, oral mentors will just focus on the oral part. But the written part is very important for you to build up your foundation to perform in oral section. You cannot just prepare for oral section and perform. You have to know in depth about each and every condition to be able to answer it for the oral section. Okay, I'm hoping it will stay easy, but it depends. All right, let's see if there are any other questions. As the right people, so as per the new pattern, written and oral combined, and combined, you're only going to get 3 attempts. So those of you in case, now what Ontario explained is, let's say you took Ontario clinical exam, OCE, and you fail OCE. And then you have to take new pattern. So 1 attempt of OCE will be counted, and then you get 2 more attempts for CPTE. So the attempts will count. Jamie, if you fail this year, you're only going to get 2 more attempts next year. All the attempts that you take this year will be counted next year. So Nidhi, the question is, you passed the clinical exam. And if you decide to go with CPTE, then they will count one attempt. You'd only get 2 attempts, which Ontario made it clear. How much time we need to prepare? Once again, like you need 5 months of preparation for 4 to 5 months of preparation for written portion, and 2 months of full-fledged preparation, because your written understanding has to be very good for you to like answer oral question. You won't be able to answer oral questions. Oral questions are easy if you understand the written portion very well. Okay? I'm residing in India. Do I have to relocate? No, I mean the whole exam is online unless they make some statement. If you don't clear the November, you only get two attempts. Right, let me give you guys a case so that you can get an idea. It's not very hard, right? Just to give you an idea what it is. So there will be a long case for you to read, understand, and then I'll show you the questions. In the next slide, I'll show you the question and the case together. Initial question will be more like, is this person appropriate for physical therapy or does he need to be referred? That's how Ontario starts. Then the questions come about informed consent. How will you start? What is the appropriate way of taking informed consent here? What will you include and all those things? Okay. Which will be taught to you. Once you know, now you start the examination. Okay. Examination will be what are the possible scenario here, what's going on, what information would you like to take? Probably question will have all the information. Okay. How he lives. This question does not have much information about how he lives. Oh, it does say apartment with 1 flight of stairs. Why do we need to know about that? Because we'll have to train him, because we'll have to make goals for those kind of things, right? Informed consent, now you basically start with what are the possible options based on what you read, possible structures that could. Now questions are going towards core question. I only added the core question, not the other one, because I haven't taught you guys for the oral section yet, or ethical section, so it's hard for you to process. But you have to possibly guess what are other possible scenarios that could be causing this discomfort. Okay, all the structures that can cause groin pain. I mean, you can start with hip OA. It has mentioned history of OA of spine, but that he might be developing OA of hip, might be a referred pain from spine. Okay, might be you might have strained some muscle, maybe adductors, adductors, iliopsoas could be. That could be groin pain. So you have to kind of explain the possible option. They ask you those questions, and they keep asking, okay, what else? They have a list of things. They want to hear that one thing from you, then they move on. All right, what else? What are the other possible options? Keep coming with other possible options. So your understanding has to be clear, which can be clear, which is not a big deal. Next, what might the history of pain with early morning pain with stair negotiation tell you? What do you understand from that? Early morning pain, stiffness, stair negotiation. What does it mean? Explain those things. Okay, early morning stiffness, probably inflammatory conditions. That's where we get that. What's the reason for stair training? Why stairs are painful? Like currently we study PFPS. Why stairs are painful? Descending stairs is painful. Try explaining that to a patient, to somebody. Why descending stair is painful in PFPS? It's challenging. Okay, why not ascending stair? So it needs to be practiced. Not that you don't know, you already know the answer, you just need to practice those things. And that takes time. Building the communication skills to explain something to somebody. Okay. What other activities, whatever diagnosis you are making that might cause pain, what other question would you like to ask? All right, so this case is more of examination case, not an intervention case. That's what OC does. One case for examination DD, one case for intervention. Okay. So does he really need lower quarter screening? Lower quarter screening is basically dermatomal testing, myotomal testing, reflex testing, to evaluate does he have neurological symptoms. Neurological means spinal cord involvement, nerve root involvement. Does he have those symptoms? If he has, we might be referring him to other professional. And some other questions can come here. But one good thing is the oral section goes like back and forth conversation. You don't have to explain 10 things, but do you know the answer? Once you answer, they check and they move on, right? So there are 150 questions. Like let's say this is 6. 150 questions. Okay, 150 questions. A lot of cases will be there. So a few cases of core MSK, core neuro, core cardio. A lot of cases, a lot of questions related to ethics, professional responsibilities. Okay. It doesn't specify how many cases, but they have explained 150 questions. 150 question, and assume if it goes for 3 hours. So you're getting like approximately 1 minute per question. So you have to be fast to explain, right? Fast to think, fast to answer. Because there are 150 questions that you have to verbally explain. One of the biggest issue that I had with students was they will try so hard to explain, they'll start talking a lot of unnecessary things. That's not a problem for OCE, but with the new pattern, if the time is limited, you'll start falling short of time. That needs to be practiced. It can be done with practice, okay? But those are the strategies we'll have to work on. Knowing the answer, what are the possible groin pain conditions, right? What will be your approach? Are there other possible conditions here? How will you rule out? Back to back, how will you take consent? Answer has to be ready. Not like the written portion where you have time to eliminate and anticipate. Oh, ABC is gone, maybe D is the right one based on the keywords mentioned. You have to be quick. But I assume it's not going to be hard. If there are 150 questions, majority are not going to be hard, but there could be a few difficult cases, which is what we need to practice, right? Possible that can cause groin pain, right? Hip joint. So our plan will be, this was a hip question. So once we are done with the hip written portion of teaching, we'll have one lecture on hip oral section preparation, or hip and knee oral section preparation. One case for, or 2 cases for hip, 1 case for knee to make you prepare after the written part. So we'll be adding that in the schedule. Shoulder, after we're done with written portion, there will be lectures on oral preparation. Okay. That is what our plan, because once you understand the whole content of shoulder, Then we'll start practicing those areas. Specific questions. What are the possible causes of pain? What are the other reasons that may cause shoulder pain? Connecting with cervical spine, shoulder, other things. Okay. Early morning stiffness. Okay. Weight bearing increases on the stairs, right? So your answers have to be precise, concise, and let's move on. Okay. Other activities: prolonged walking, sitting, standing transitions, in and out of the car, getting up from the commode, more painful. If we are suspecting arthritis, anything that will increase joint loading, those things have to come fast, and that has to be practice. Then it can come fast, not superficial preparation. Additional questions to rule out, basically rule out the nerve, rule out joint. Other problem, rule out infection, tumor. All right, hernia, sudden. Other possible diagnoses. So you'll try to eliminate other options. The hip, you'll do these tests. Iliopsoas, you have these tests. I'll rule them out based on these. If I'm suspecting radiculopathy, what am I going to do? The special tests. Not that you don't know all of this. You do know all of this, but now you have to combine. All right, can I think? Yes. So once the preparation will change, you'll be able to think also. Okay. Do we need lower quarter screen? Yeah, so sciatica is involved. It's a good idea to do the lower quarter screen. Right. Okay. So you got a hint superficially what would be core questions. And on this, there will be added questions like consent, is he appropriate for PT, and so on. Then there could be some questions, some case scenario for just ethics, or how does he live? Sometimes case could be patient had a hip surgery, is being discharged to home, he lives with his mother, and he's the primary caregiver of his mother. He lives on second floor. I mean, he has to use stairs to get inside the house. Now making a plan, what can we do for him? If he's the primary caregiver of the mother, he needs care. If he needs care, who's going to take care of the mother? We'll have to make some arrangement, give him options, explain him what can be done. Okay. So more deeper preparation, you'll have to study, more content has to be prepared, because right now for the written portion, you don't have to prepare for these things. Prioritization in depth, planning in depth is not needed, but now it's part of the exam, so it has to be prepared in depth. All right, so I'm going to open it up. You guys can raise hand if you have questions, and I'll set you guys options. Answer questions. Let me start with you guys. And make sure your names are full. If I don't see the full name or correct name, it's hard for me to give you the chance. Okay, just fix your name so I can give you the chance. All right, so Rikita, we can go with you, then Pooja, Kareem, Yogita, and Sassy. So Rikita, let's just start with the question. Hold on, let me unmute myself. Go ahead, Rikita.
Hello, am I audible?
You can just give you a second. I don't know if Rikita has a question, or if Rikita doesn't have a question, you can start ahead. Yogita, you can go ahead.
Hi. So I'm just planning to give my CPTE next year whenever it launches. So I just have quick questions. So when are you planning to begin this your classes for CPTE? So in case I want to join.
So written portion is not going to change. Whatever we teach for the written portion will stay the same. Only addition will be the oral section. Oral section will have separate classes, and that will start. Probably a few classes in the next cohort, August, few classes, and full-fledged from November cohort.
Okay. Another question. I was trying to find the blueprint for
Just
this
search on
exam.
Google, or maybe somebody else, if you guys can share the link here, so she can get the blueprint.
Okay. Thank you.
All right.
Hi, sir.
Yeah, Harim, go ahead.
So this is Pooja.
Yeah,
Sir,
Pooja, go ahead.
my question is like I lived 10 years in Saskatoon. I have a house there, right? And my first attempt I have given in Saskatoon. Now recently I moved for my husband thing in Alberta, but if ever I give exam in Saskatoon, right? So I don't have to give a clinical exam, right? And then later on, if I want to move in Alberta, how many clinical hours I need in Saskatoon to complete, or what is the scenario in this situation?
I don't think you need any separate hours. If once you get full license, you can just get it transferred to Alberta. Because right now, that's what Alberta is allowing for people to like complete their license exam in Ontario, and they can just transfer. They don't need to cover any extra hours.
No,
Or
no,
if
my
there
question
are hours,
because sir, Saskatoon has like Saskatchewan just write a written exam. Say then you can get a license. You don't need to give clinical exam, right?
Mhm.
So then,
Yes. So if you have completed,
मामा 5 मिनट दे दो मुझे बस
if you have completed the hours for Saskatchewan, get that license for Saskatchewan. Or if you have not, then pretty much you're starting from scratch. If you have completed the hours for Saskatchewan, get your license, you can get it transferred to Alberta. But if you have not completed that, then you have to pretty much take the exam if you're in Alberta. Whatever. Is that what your question, Pooja?
yes, sir. Because now my plan is to give exam in November because I have to start everything from zero again.
Which exam? Alberta exam?
No, sir, like a written exam now in Saskatoon.
But you have not passed the written part yet, right?
No, not yet, sir.
Yeah.
So that's why I'm asking you, what should I do in this scenario? Should I write from Alberta because I don't?
So what I'll say is confirm with Saskatchewan if they are going to allow these hours for those who pass the written portion this year. Will they
Hmm.
continue allowing us to complete the hours and get fully licensed? If they say no, we will not, then go with the new pattern, which will be from next year. Then it's not worth taking PCE this year, the written portion. Then go with the new pattern. If they say yes, we will allow, but you'll have to explain a good scenario. Okay. So if they allow, just get it done, get your hours done for Saskatchewan and get fully registered and then transfer your license. Okay.
Okay. And sir, another question. I have registered like my courses until July. My deadline with you, I paid until July, right? And now I'm planning until November to study. Though I maybe don't need that videos, but I need a mentorship because I have to pay extra for the mentorship, right? Then how it is gonna work? Like I have to pay you extra, or what is gonna happen, sir? Because
For
after
the new,
November,
for the current pattern or for the new pattern?
for the current pattern.
Yeah, if you're going with the mentor, if you continue with the mentorship student does not have to pay anything extra for the classes. So not needed. Okay.
So
If you don't
sir,
take mentorship, you'll be
I
paying
didn't
it.
pay for the mentorship yet, so I have to pay for the mentorship, and they will provide me mentorship until November, right, sir?
You have to confirm with that. That's not a relevant question for this class. Okay, Pooja.
Okay.
That's
Okay.
about mentorship for the written portion that you should be reaching out via email, and they'll give you the content of mentorship. Okay, so that should not be here. Ask
Okay, sir.
about the new pattern only. Okay,
Okay,
just
sir.
write an
Thank
email
you, sir.
with the details.
Hi, sir.
Yeah, go ahead.
Yeah, if you fail the written exam, it's my second attempt. If you pass it, you will promote for the OC for the next year, and there is no working hours. They are giving you. They will offer you
So now, when do you plan to take your written portion? Sorry,
October.
October. Well, Ontario did say that they will give you OCE the whole next year.
Mm-hmm.
But whole next year only means your exam is in June, and I believe 2 more attempts are only like 2 more times after June because they don't conduct that often. So again, that needs to be confirmed with Ontario that will you allow if there are students. They did say that if there is a demand, you will allow. but more clarity, I'll say reach out to them, write them an email, get some kind of confirmation from them. So they'll get an idea that, okay, there is a demand, so we should continue. It's like that.
Okay, and one more question. If you fail that second attempt, how many attempts I left for the CPTE?
Just one attempt.
Okay.
So keep in mind, everyone, CAPR is nobody's friend. And if you're somebody who fail or anything, don't even give 1% of like any sympathy towards those students. Brutal. And not just CAPR, all the provinces, very brutal. So if you are prepared, and if these are your first attempt, or like even if you just one attempt left this year, you're going for exam in September, make sure your preparation is so good that you pass and you get the exam for OC or whatever the province you're in. Because if you fail, they'll count your attempt, and for the new one, I mean, they'll give you whatever is remaining. They're not going to give you extra 3 attempts. That's what they did when CAPR back in the day was conducting in-person clinical exam. And then they could not conduct. So those who failed in person, they had to wait until each province came up with a pattern, because they could not conduct exam for 2 years. So those who failed were not allowed to work for 2 years. And then each province, when they allowed clinical exam, they were only given what was the remaining number of attempts that was remaining. No extra advantage. So make sure our preparation is good so we get it done. Okay.
And how many attempts for the CPT in total? 3?
3 attempts. Okay.
Hi, sir.
Yeah. Hi, Vishali. Go ahead.
How are you?
I'm good. Go ahead with your question.
My question is that I last week only enrolled with you with PCE written course. So, and I'm planning to give like my first attempt in 2026 only. So, do I need to enroll with your OCE clinical right away, or sorry,
The oral
OCE
section, no, you
exam?
don't have to enroll right away because we're not teaching anything for the oral section yet. We'll be starting that teaching from next cohort, some portion, probably MSK, and then full-fledged will be from November. When we start, we'll release what will be the fees for the oral section and what are the instructor and what are the options you guys have. We'll release those things at that time.
Okay. Thank you so much.
Okay, Vishal. Sassy, go ahead if you have a question. I'm going to give a chance to other people. Now you can go ahead. Mohammed.
Hi, actually, it's Mohammed here. I'm
Yeah, Mohammed.
actually asking for, especially for my wife,
Hello.
like she's trying to start
Yeah.
a practice exam in July. Like she's moving here next month and trying to practice exam in July. And we are from BC, right? So I'm just wondering, like, it's a new exam, it's gonna be better, or the old one?
She's going to start preparing now. Is that what the plan is?
Like she's moving here next month, so I'm thinking like after 15, 20
I
days,
think
probably end of June.
because will be moving next year, then you'll start with the credentialing and all. So probably I don't think you have chance to take exam
No,
this
the
year.
credential and everything is done.
Okay. So
And it's BC, so I'm like
I
confused.
mean,
Like,
I won't. So BC clinical, we don't recommend anyone. BC or Alberta, if you're have to take in-person clinical exam, we don't recommend anyone because a lot of students have failed. A lot of students. But what students have been doing is they pass for BC exam, I mean written exam, even though they are based in British Columbia, they take the Ontario exam, OCE, they pass OC and then they transfer the license to BC. That's what majority of students have been doing. Nobody's going for the in-person exam because it's more intense preparation and it's hard. Again, everything depends on if Ontario continues. Chances are less because Ontario is not going to continue beyond 2025, end of 2025. And after that, probably they will not continue after 2025. So in your case, I think the only option left is go with the new pattern, which will be starting from 2026. But even for that, also she has to start preparation, and that she can start from next cohort.
next cohort, which is in I think in August, right? If I'm not wrong.
August. Yeah, I'll say let her come, settle down, and then start if there is no rush because she'll have to spend time for this
Okay.
preparation.
Okay, sounds good.
Okay, Mohit. Naz, go ahead. Naz or Prachi? Prachi, you want to go ahead?
Hello, can you hear me?
Yeah. Yeah, Naz, go ahead.
Yeah, my question for you is if at all I appear for the old pattern this year and say suppose I don't clear it, so that will be I'll have to attend for next exam, right? As per the CPTE, I won't be able to appear for the old pattern. Am I correct?
Yes, yes.
Yeah. With limited attempts, of course,
Yes.
because I'll be using my first attempt and the 2 attempts for the next year. And
Yes.
second question is, as far as the written classes are concerned, it's going to be same as you mentioned. So will we have other oral classes separately, like the OCE, or will you just incorporate it in the written
Yeah, it will
because
be
the
separate.
format?
It will be separate classes. And
And
as I said, it will be a separate fees also for that.
okay, so the November cohort will include written and oral both, because
Yes.
I'm planning to start the practice, right now. So should I just go with the written thing, or should I wait for the
Yeah, and
November
that's what we
cohort?
recommend most people,
Mhm.
because the written takes the most time.
Okay.
Oral is the same content, you just need to practice. The written
Okay.
will take a lot of time. Even
Okay.
though the portion is less, but the
Mhm.
content is same, quantity is same.
Mhm.
That will, if you have to be very good with the written part to actually even think of passing the oral part. Once
Okay.
you understand the written, oral will go much smoothly.
Okay. So basically, the practice is gonna be separate. It won't be together. Am I correct?
We are not combining both in the same.
Okay. 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 Okay.
All right. Zeba, if you want to go ahead.
Hello.
Yeah, Zeba, go ahead.
Yes, sir. My question was if right now I'm starting my credential processing. So, like, it's just started. So, once my credentialing is over, what I want to know is what is like the most amount of time I can postpone my exam? Like, for example, uh,
2
is
years.
there a limit?
2
Okay,
years.
okay, okay.
Yeah.
Okay.
You have to take
Thank
the
you, sir.
first attempt in 2 years.
Okay, so under 2 years, I have to take exam. Okay, okay. That's the one thing that I wanted to ask.
You don't have to
Thank you,
pass
sir.
the exam in 2 years. You just have to take one attempt in 2 years. But
Okay,
be careful.
okay, okay.
A lot of people, what mistake they do is they keep delaying the exam, and then they take one exam just when it's about to expire, which, and most likely most of them end up failing that exam. Now, I'll say not to mess like that. Um, start preparing in advance whenever it's expiring, at least 6 months before that exam. Okay.
Okay. No, I was planning to go with like as soon as the credentialing is over, I'm planning to take it 1 year after my credentialing.
So
But I was not
why do you
sure.
want to wait for credentialing? You have to
Oh,
do
that's
something in
because
the
no. I just started my credentialing program, process. I just my college and my university still has to send the documents back to the CAPR. So that's one thing. So I think I
Okay,
have
that's
to.
fine. That's fine.
Yeah,
What we recommend, what most people do when they
yeah.
submit all the paperwork, they start the preparation, because CAPR will take 6 months or like few months, not 6 months, 2 months, and that will be enough time for you to prepare, and not enough time to prepare, but at least you can start your preparation. But that's fine. I'll say take your time. Maybe next cohort might be better for you to start. Okay.
Oh, sure. Thank you, sir.
Okay. Shruti, if you wanna go ahead.
Hello, sir. So
Yes.
I'm just planning to start the classes from next cohort, maybe possible in the new format. But I just want to ask, like, what I can study right now at home, like, because even I'm working, so I just have a limited amount of time to
Study, I
study.
mean, be good with the basics. Be good with the basics, which is anatomy, muscles, origin, insertion, function. Nothing more than that. If you want to finish special tests, that'll be good. Um, Read a little bit of book if you want to, like Kistner, you can read, or some notes that you can start. But at least start with the basic. Be good with muscles, the function, the origin, insertion, those things.
All right. Yeah. Thank you, sir.
Cool. All right. Krupa, if you want to go ahead.
Hi, sir. Good evening. My
Good.
question is, I
Uh,
took the May cohort batch and I'm just attending few lectures. I'm trying to attend the online lectures, but I see the recorded videos. So now my question is, so this batch will include only the written ones, right?
yes.
For the oral ones, what will be the charges? And
We haven't confirmed anything for the charges yet.
Okay.
We have to make a plan. We have to get the instructors. We know what's included. We just have to get the instructors. I'll be teaching this part, MSK cardio and ethics section. We just have to get neuro and other systems sorted out.
Okay, sir.
Yeah.
Okay, thank you.
Okay, Prabha.
Yeah,
Chandi, you
thank
have a
you.
question?
Yes, sir. Hello,
Yeah.
are you able to hear me?
Yeah, I can hear you.
Yes, sir. I have a question that I'm planning to give exam in October 2025. And if I pass the exam, then how many attempts they will give for the OCE exam?
Well, see, you get 3 attempts, but keep in mind, you're not going to get 3 attempts because they're not going to continue exam. Okay, they will end the exam. So if we can get 1 attempt, I mean, we can easily pass in 1 attempt. It's not a big deal, but they're not going to give more than 1 attempt, most likely. Because right now, if anyone who's failing OCE has to pretty much wait. For example, there's exam recently, and if they fail, then they cannot take the next OC until 2026 June or later. So you'll have to wait a lot. So technically, there's a very high chance if you decide to go for OC, you're not going to get second attempt. You'll be 1 attempt only because they won't continue exam. And if you fail, then you have to go for CPTE, then you get just 2 more attempts for CPTE.
2 attempts for the CPT, like for written and
New portion.
practical?
Yes, it's 1 exam only.
Okay.
Yeah.
But basically, if I give the written exam in October 2025, so
They are not gonna change.
would I be left with the 2 attempt or the 1 attempt?
No, it will be 2 attempts. And that's what Ontario said.
Okay, so what should I have to do?
Again,
Because I'm so much worried about the OC exam. Like I want to pass, but in case if I'm not able to clear it, then
you'll be going. Okay, so if we get OC success rate is 95%. 95% of our students pass. So chances to pass is very high. Don't think if we can get an attempt, most likely we'll pass, unless we make a big blunder. That's the only thing. And the chances to make blunder is very less because you start working after your written part. You start building up a lot of skills of how to talk to a patient, how to take consent. You know how to deal with the social worker. You know how to deal with the nurse or other people. So a lot of things, communication skills improve. You know what all tests you're using for examination, transfer techniques if you're using. So you build up those things. Chances to fail in OC is very less because of the work experience you get. Okay? So if you get a chance, I don't think you'll fail.
so just for now, I have to just for now, it's like that for 2025 people, like there will be the only 1 attempt for the practical exam until 2000
Most likely, yeah.
June 2026, right? Then
I mean,
after
they
they
will
will
come
be
up. They
clear
will come
that
up.
to how many?
They will come up with more attempts, more exams for OC next year, and I believe not more than 2 exams. They don't plan to continue it from 2027. They plan to end it in 2026. But again, as I said, if there is a demand means if they keep making money, they don't have a problem, right?
Okay.
So most likely it will continue.
Okay, thank you, sir.
But continue for first timers only. I doubt that they'll give chance to second timers because they have to accumulate first timers. Okay. But don't worry right now. Make up your mind. Let's start. Whatever you prepare for the written part. Let's say you decide to take a written exam this year. Okay, everyone. This year, let's say October, November. That written preparation is not going to go in waste because that preparation continues in the new pattern with less questions. So you can easily pass the written portion, and then you just have to focus on the oral section. Even if it's your second attempt, written portion will be good, and you have a higher chance to pass the CPTE because you'll be focusing more on the oral section because you'll be good with the written part. Okay, so don't think preparing for the written portion now will go in waste. No, that will stay even in the new pattern. It's not changing. Okay.
Okay. Thank you, sir.
Janya, want to go ahead? And then Krishna, you can go ahead.
Am I audible, sir?
I can hear you, Janya. Go ahead.
Sir, I did credential process last year, so this October will be my expiry, but I didn't pass my language proficiency yet. So they emailed me like before October, you need to appear your first attempt as well your language proficiency.
Yeah.
So can I appear? Can I book my exam before my language? Like
No, they have
without
to approve you. They have to approve you first. So they're not going to approve you without your written portion. So they need to see your result that yes, you can pass. They're not going to approve it before without that.
Okay, because I emailed already and asked them the same question, but they didn't reply, so I was confused. Like,
Try emailing, like just ask them. Sorry for clarification. Can you confirm? Can I book the exam without my written results? But they haven't allowed. Just so you know. But it's good to ask them because things are changing, so they might allow you to book the exam.
okay, and sir, one more question. Like I'm from Nova Scotia, so after the October, Nova Scotia Physiotherapy College announced that you should start your mentorship program by September 1st. So August is not the good exam month, right? Because we didn't get and we never get the result within 2 days.
So Nova Scotia said that you should start your mentorship since from when? From September?
Yeah, so by September 1st, yeah.
And not after that?
No, the timeline, the website downward says few dates, and the date says, yeah, by 1st September, you should be in mentorship program.
And if you're not, then what?
Then you're not eligible for apply like for IC full license.
All right, I'll have to read that document once. I mean, if that's the case, then you should be going with the new pattern then.
I'm trying to approach any of the Nova Scotia student, but I didn't find any of them. So
No, you don't have to find anybody. Because probably they'll be confused. So I can check the document. Just reach out to us. Are you already enrolled in a class?
yes, sir. I already finished my first
Cohort.
batch, and this
So
one
I'll
is
say
yet.
right now here, thing is that focus on your TOEFL. Give you full time for TOEFL. That needs to be done because they're not going to allow you to take the exam. Keep PC aside right now. Get that TOEFL done. Okay. Give your best. I mean, you can only try, right? I understand that sometimes things can go up and down, but let's give it a try. Let's give your best. Once that is done, we can figure out about PCE. Like, is it worth? Because in your case, you don't have option to push it beyond October. You have to take it before October. They will not allow you. But it's okay. We'll try. And then even if Nova Scotia doesn't have option, we can go with other province who has options. And Ontario you have to take exam for Ontario virtually. You don't have to be in Ontario. Okay, so it doesn't matter. But focus on TOEFL now. Okay.
Okay, thank you, sir.
Krishna, go ahead.
Hi, sir. You did pretty much answer my question, but I wanted to confirm once again. I will clear the exam in November, written part. What are the chances of getting registered with OCE for the next year?
For the next year. Next year chances are less. Okay. Because July dates are already open and they are getting full. It's not full yet. Sorry, June dates. And after that, they conduct exam in October.
So
yeah, so I think that's what it is. And there's no exam in November for OC. So you're not going to get October dates. But seems like the demand is high. So they might open up dates for 2027. And if they open up dates for 2027, I mean, we're good. But again, I don't want you to take my words for that because they decide if they want to offer more or not. And they can flip anytime. Okay. So
you think now going for November exam this year is better or CPTE for the next year?
Then since we are late for November, I'll say go for CPT only.
But I did started preparing from last 2
So
months.
why are we going for November then?
I'm not sure because I'm working full time, sir.
November will not give you any chance. You can continue working full time. Basically, if you want to make money, keep making money. But they're not, you have to understand that Ontario will not give a chance. You might continue working and you might be taking it the new pattern. So you have to decide if you're working because of the PR and other things, sit and make some decision. You're pushing it too late. Okay. Try to see if we can August, September. That's what it is. So push, because the later you go, the chances goes down. Right? Are you a student, StudyBuddy?
Yeah, yes.
So don't delay now. Let's push for that. If you have everything in your hand, if you're eligible, take it. Don't delay with your work because of your work.
Okay.
Okay. Have a decision like why are you working, and then if you have a partner, you have a friend, discuss with them what's going to happen. Can you go this year? Okay.
Okay. Thank you, sir.
Yeah. Manthan, then Zishan, and then Jeremy.
Yeah. Hello. I'm audible?
Yeah, I can hear you, Manthan.
Yeah. My credentials are expiring in May 26 next year. So basically, when should I start preparing for CPTE exam? I mean, what
Well, we're
is the
starting it from
sufficient
the
time
we
for
are starting from
preparing
the
that?
next batch. So I think
Okay.
You can start from the next batch because, as I said, written portion nothing changes. What we can do is we can offer some in written portion. Focus could be more on a few more things, but that has to be done for you guys to like actually answer any question. And then oral preparation will not take much time if your written preparation is good. So I'll say if you have time, focus on the written part, get that done. Once you understand the written portion very well, oral portion will go very smooth. So I'll say maybe next cohort that starts in August.
Okay, it will start in August, right? Okay,
Yeah.
thank you.
Yeah. Okay. All right, Jishan, go ahead.
Hello, sir. Can you hear me?
Yeah, I can hear you.
Okay. So, sir, I started my preparation in March with StudyBuddy, and so far I've covered everything which you have taught in this like previous cohort, and I've revised everything twice. My neurology portion is still like pending. My initial plan was to take exam in September, but again, the OC clinical date still is a question that if I take exam in September and if they don't give me date till next year, then I have to wait all the way till the next year to decide whether I'm going to be eligible for the clinical exam or not. And in case if they don't give us the date, we have to take the CPT exam. So my question is, if I wait till January and I book the exam in January, so far I've prepared pretty much everything. Don't you think that it's a wise decision that being prepared for all the written component and then take few more months to prepare for the clinical exam and get done with all these things in the single go instead of waiting for the whole year to get the clinical exam done, which is still
Yeah, I
is a
think
possibility that they're
in
not going
your
to
case,
conduct.
yes. I mean, if you want to go for Jan, yes, I think Jan may be a better option because you've been preparing, so your understanding is definitely getting better. So now you can just start incorporating a little bit for the new pattern. Okay, like how I showed the case, so you can start connecting the dots. So I think you are in better position to take January or other exam in February. And initial exams are always easier also. Okay, they don't grill so much. And gradually they understand what's going on, what needs to be changed. Eventually it gets harder. That's what happened with OCE also. So I think you're in better position to take this new pattern.
So, sir, if I want to go for CPT, would you think that the January exam's gonna be a better option, or the exam that's coming after January would be a better option? Because like as far like nobody knows what's gonna come in that exam.
January will be good. January will be
Okay.
good. Does not matter. Keep in mind it's all about MSK neurocardio. So the understanding is good. It's gonna stay the same. And you can also go and check. Ontario has made some changes to their OCE exam. Now they're incorporating ethical section in those two cases that they're giving. So if you also take a look, like right now when you're preparing, also take a look at what are the questions, what are the areas that you need to understand, because those areas will be pretty much in CPTE because they're kind of testing. A lot of those things will stay in CPTE. And because when I compare the syllabus also, this one exam, oral section, and the Ontario exam section, a lot of questions are similar. So it does give us a good idea what's gonna stay. And all these boards make CAPR. Each board, Ontario, British Columbia, Alberta, they make CAPR and they make suggestions. So they will have a bigger role. Ontario is the biggest one. They make a lot of decisions.
Right, sir. Sir, one more question. So I was planning to take on the mentorship. So what would you suggest? Should I continue doing my preparation on my own and take mentorship
Right
when the
now,
clinical exam is near, or
right now
should I
I'll say,
take mentor and get done with the written preparation?
no, don't take mentorship right now for the written, because you may not need, or you might need mentorship for the oral section, whatever it is. We'll have to work on that. I won't recommend you to go for that. Right now, keep practicing, keep improving your skills based on the clinical cases and questions. And eventually, once we are full-fledged preparing, you can start pushing for that, for the oral section.
All right, sir. Sir, one last question. So as you said, don't go for the mentorship yet. So when I'm going to be preparing for this written exam and I book my exam, OC, I guess Ontario College has, CAPR has mentioned that they're going to launch this new exam dates in July, and we have to book that exam in July. So if I book that January exam in July, when should I take the mentorship? And
Then
that
you can start.
mentorship will include written and oral sections both?
No, actually, the written mentors are not trained for the oral part. We have
Okay.
separate mentors for the oral part. It's not going to include both. We can see what can be done if it needs to be combined, something like that. But then I'll say, if you want to go with the written mentorship in August, and if
Okay.
needed, you can go with either oral mentorship from November. Oral mentorship is not going to be longer than a month. It will be concise, but you'll be spending a lot of money on the exams. Oral exams will be 3 hours exam, and we'll have a registered clinician from Canada will be conducting the exam for you. That will be good practice for the oral section.
Okay, sir. And sir, sorry, taking so much of your time. So one last question. So when should I go for my mock exams? I have covered all the quizzes and I passed everything, but I haven't taken any mock exam yet. So
Start the
when
written
should
mock
I
exams from
start taking
August.
the mock exams?
Start written mock exams from August.
All right.
A little bit, start getting comfortable with them. If needed, we can repeat it in November also.
Okay.
Just for practice. Because most of our time will go towards oral preparation in terms of building up our skills and taking oral exams. So let's get done the written part. Sooner is better.
All right, sir. Thank you so much.
Okay.
Hi, sir.
Jem, go ahead.
I have just received the confirmation for booking the exam, and I have prepared for 2 weeks only. So I'm planning to have the exam in November. Is it acceptable to book for in November from now, or book in October? And I see myself if I want to extend to November, which is better?
Sooner is better, gentlemen. And I believe you're in Ontario. Are you
Yes.
based in Ontario?
Yeah, in Ottawa.
So sooner is better because even Ontario cannot continue conducting this exam forever. They will eventually decide that no, we are not continuing beyond 2026 or 2027. So I'll say sooner is better. If you can take the exam as soon as possible, it's better. In case, let's say, think of a worst case scenario. Let's say you take your exam in October, right? You pass the exam, but Ontario is no more taking students, right? And then you'll be going for the new pattern. New pattern is not going to be hard for you because new pattern will have less questions, 100 questions, plus you've already taken the written exam. So that knowledge can be transferred to pass the new pattern, 100 questions only. And then whatever time you have remaining after October, you can focus on preparing for the verbal section. So it's a risk. We have to decide if we can, taking the exam in October, is that a good idea? Because are we going getting the dates for OCE or not? But you know what? Before October, Ontario will make it clear if they are continuing in 2026 or not. If they're not continuing, then we can just go with the new pattern. we'll get to know that before October, because dates are getting full now, and they might let us know in 1 or 2 months. They'll have some future meetings coming. So we'll get to know before your October exam if you want to go for that.
Okay, is it enough time for me to study?
Yeah,
I stopped
time is
work
enough.
now. I stayed at home.
Time is enough. If you're studying, time is enough. I know you just started, and even November is also fine, but we can wait and see if Ontario decides to continue their exam. If they decide no, we're not continuing, then yeah, we'll be going with the new pattern in January. If they decide to continue, then we'll go with OCE. Then we can study harder.
Okay,
And
thank you, sir.
they will let us know before your October or November exam.
Okay, perfect.
Yeah. Krupita, go ahead. Do you have a question, Krupita? Okay. I see some questions in the chat. What is the processing criteria for CPT? Well, they haven't released the processing criteria, but it's going to be same, like you have to get at least 70%. You have to pass both written and the oral section. And Vani, give me 1 second. You have to pass both written and oral section. The passing written section will not be challenging. Oral section, they'll decide your communication skills. Are you able to explain everything? Do you know all the answers for 150 questions? See if patient safety is important. They want to evaluate, do you understand the safety scenarios? If you do, you pass oral. And yes, I mean, for the written part, we can definitely make you very good. Yeah, Vani, go ahead.
Hello, sir. I've given my first attempt in April, but I was not prepared. But I had to give the exam, so I got 500, and I have even watched all the lectures. So I have booked already for the July. So do you think I should go for the July, or should I get well prepared and then go for the CPT?
I know if you can't be well prepared for July, go for July. If it is not, I won't recommend in your case. Okay, because it's like 150 questions of oral. It's going to be more challenging to explain. So if you have a chance, get it done now.
Okay. And do you think, sir, is mentorship necessary? As it's my second attempt.
It will be a good idea for second attempt. I'll say I will strongly recommend that, because it will cost you 400 Canadian dollars. Yes, that's money, but they will definitely raise your performance by 15-20%. Yeah.
Okay. Okay. Thank you, sir.
Okay. Let's see. Questions. Is it good to give exam in September? That's Krupita, that will be a good idea. I'll say September is fine, book your exam. If anything changes, Ontario should let us know in advance. And they will make us aware that if they are continuing. If they're not continuing, then we can always push our exam to January next year or February next year. If they're continuing, then we can work hard to pass the exam in September. Yes, Ritika, you'll be able to reschedule if needed from November to next year. That's completely acceptable. How many questions there in OC? OC, the current pattern or the oral section? Well, the current pattern OCE has like 2 cases, case 1, case 2, and I believe each case has like 10 questions. Case 1, case 2 goes for like, I mean, you have 45 minutes for case 1, 45 minutes for case 2. So basically you're spending 1 hour 30 minutes for case 1 and 2, another 1 hour 30 minutes for 11 categories of ethical questions. Each ethical questions usually go fast, those 11 categories. So that's not very challenging. Current OC is still easier than the CPT 150 question. How many full-time hours needed to prepare for exam this year? Well, yeah, 5-6 hours at least. So as you mentioned, Ontario will be letting us know before October or November whether they are going to continue or not. Can I book for example November? That's right, Krishna. That's what I'll recommend. They'll let us know. We can book the exam in November. And if Ontario says that no, we are not continuing, we are already full until 2027 March, we are not continuing beyond that, then we can always move it to new pattern. So, but I'll say take the date if you guys can. Can they give exam from another country in India? Well, I think right now they are, Ishan. And I'm pretty sure they should allow. I don't know, I haven't heard of anything that has changed when they can change any time, but I believe they will allow. Everything definitely does not have a higher chance to pass because your preparation has to be more intense. But keep in mind, Canadians will be taking the exam, right? Probably in January. If they are, they have a good clinical understanding because they do rotations, a kind of internship in Canada. They know a lot of internal system, like what to do with the patient when he's not ready to be discharged to home, what to do with the patient when his family is not cooperating. So they know a lot of those ethical sense things. So for the oral section, we know a lot of professional responsibility is important. Okay, so it's definitely not going to be easier than compared to the written current pattern. And you have to learn more. A lot of those things, when family is not responding what to do, you cannot learn from a textbook. I mean, we can give you some cases, but that's not 100%. So your clinical understanding, if you guys are working right now, start understanding those cases very well, what your therapist is doing, that those things can make a difference in your preparation. And what do you suggest? iPhone, if you only have one attempt left, can you take the exam as soon as possible? If you can take the exam as soon as possible, then we'll have a chance for OC. That one attempt, not a good idea for new pattern. When will exam be held in January? Usually the exam held the exams at the end of each month, and I believe they are going to continue with that. So it will be end of January. And exams will be held 8 times a year, as they mentioned, probably like every 2 months, sometimes every month. You guys will have some chance to move exam if needed from January to February, like what students are doing right now. So in college, but I don't have a job, so I have time to study. I joined StudyBuddy 1 this month. I start my credentialing process now by the end of this month, and I was thinking of giving written exam in October, because then I'll get a chance to give my oral exam in June. Not in June. June is already open right now, it will get full soon. But you can get some chance if Ontario decides that they're going to continue beyond October 2026, then yes, there's a chance for you. And they'll let us know before your October exam that are they continuing or not. If they're not continuing beyond 2026, then it's a good idea to just go with the new pattern. Whatever you're studying, it's not going to go in waste. It can be used for the new pattern. Okay. Prince has a question. When should I go with the exam? Well, Prince, if you can, earlier is better. September is what I'll recommend, Prince. Well, Darshan, I don't think we need, because most of the exams happen at the end of the year. That's what CAPI conducts right now for the written portion also. That will stay the same. Prachi, will you get the OC dates? Well, we can wait for the confirmation from Ontario before your October exam. We'll hear definitely something, because the June is open. I believe the next one will be October. October, if that opens, we'll get full. We'll get full before this year, October. 2026 October Ontario exam will get full before this year, October. And you'll know if they're opening more dates. They're going in 2027. If they are entering in 2027 for clinical exam, then yes, you will get the dates. If they decide no, we are not going to continue further beyond 2026, the chances are very high for that. So we'll know about that before October exam. And if we know that there's no Ontario exam anymore, then we'll go with the new pattern CPTE. No, Rati. Ontario, the new pattern is completely online. You have to scroll to Princi, approximately 70%, 70 to 70%. If you have 2 attempts left, is it good idea to go for CPT? I'll say yeah, because you're not going to get more than 1 attempt here, so maybe just wait for the new pattern exams, but start preparing early so you have an edge. Well, how should you navigate, Raj? You need to spend more time. So you have to ask yourself, how can you get more time? If you're spending 2 hours a day, it's not happening in October, guaranteed. You have to ask yourself, can you spend 4 to 5 hours a day now, since you're studying? Do it for a week, 4 to 5 hours a day. 4 hours will allow you to finish 1 lecture with notes. Done. See if you can do it for a week. Can you spend 4 hours every day for next 1 week? Are you finishing 1 lecture? Are you able to finish 7 lectures in 1 week? If yes, you can, then we can see that you'll be able to finish all the content in 2 months, and then we'll need probably 2 to 3 months of preparation. 2 to 3 months of practice exam preparation. So practice exam, at that time, I'll say you'll need 7, 8 hours a day at that time. At that time, I'll ask you if you can quit a job or take a break from your job for some time. That would be helpful. So Darshan, what happens is they will allow you to book the exam. They will allow you to book the exam because your exam booking will start from July. They will allow you to book the next year January exam. Even if your credentialing is expiring on January 2023, an exam could be at the end of the month, they will still allow you to book the exam. How it will be decided you have passed or failed? Yeah, most likely for the written portion, 70%. Oral portion, nobody knows. That person will decide. There should be certain number of questions you have to get correct out of 150, but they'll be more strict on safety ones and those other questions. It's not overall 150. Some questions will have more weightage. That person will decide if you're good for that or not. Okay. But to focus on exam preparation, obviously repeat more and tell yourself the new pattern is going to be more harder. You'll have to study even more. So focus more on preparation. Yeah, I think everything both will be online. Oral section can take 2 months, 3 months approximately, 2 to 3 months. All right, guys, I think it's been a long lecture, and I guess you guys are also getting tired. Let me see if there are some Q&A questions towards the end. Expiring next year, 2020. Manthan, I think they'll still allow you to book the exam. You can start preparing from from August. Everyone who wants to go with the new pattern, I think you guys should start preparing from August. At least so you can focus on the written part more first, and later on, you can focus on the oral sections. You're not trying to juggle both at the same time. Cool. All right. Wait, you have a question? Go ahead.
Yes, sir. Thank you. So, sir, I'm one of your old student, and this is my final attempt. I'm also taking mentorship program, and my question, I'm planning for August, and now I'm very confused with am I in right direction or not? Because this is my final attempt. So should I go with August or should I go for January?
No, go for this one.
This one?
January is going to be challenging because 150 oral questions with limited time. Because it's a 5-hour exam, so 3 hours, 150 questions. And sometimes you might need more time for your brain to think and give up an answer. You don't have more than approximately 1 minute or 1.5 minutes for some questions. A lot of questions you'll do good. Because a lot of questions will be easy, so we might be able to finish in 30 seconds, but still overall it can take more time. with the new pattern. So I won't recommend to take a risk. And the problem is with the new pattern that one person will decide, who's your examiner, that, oh, I don't think you answered this one correctly, or this one correctly, or maybe he did not hear you correctly. He missed some of the points that you were trying to explain. No, I did not hear that, and then done. So new pattern is like very much that person can make your decision, not the computer. Current pattern, you get the score. They cannot do any manipulation there. They know how many questions you got correct. You cannot do anything. New pattern, that person can make a lot of decisions. I don't think your answers were clear. I mean, that person may have some perception, doesn't mean you don't know that answer. And that perception can make things difficult. So if you can give it this year, ASAP, it's a good idea.
Yeah, so no, so I'm planning for August. Yeah. Thank you.
Okay. All right, guys. I think no, I just don't do anything. Just wash water. That's it. Oral section same like OC. That's pretty much Priyanka, same like OC. Also, eligibility criteria is nothing, just PTE degrees, you know. If CPR conducts a new pattern exam after January, will I be able to pattern exam after January? Probably not after January, Darshan. There's a chance you might get lucky. The chances are less. Chance if somebody catches the error, they might come after you. So not to go beyond. Okay? If you've decided for January. Rati, CPT could be better option. Did you take the first attempt for Ontario clinical? Sorry, British Columbia clinical exam? I wanted to make sure that you mentioned the OS will be of 3 hours, but I think I get it. Actually. So I think oral section, I think it's going to be 2 hours. Or I'll have to check again. If you have read something on the website, it says 2.5. I'll check that part. If it says 2.5 and the new pattern, I think by mistake, maybe our Instagram group might have promoted that, but I have to check. It could be right. I'll have to confirm that part. 2.5 hour for written part, that will be good actually. And then 2.5 for oral will also be good, because if oral is 2.5 hours, 150 questions, then I believe the questions are not going to be very intense for the oral and it will be manageable. But it could be possible with Quincy. I'll have to check that part. If it's 2.5 hour for both, or is it 2 and 3 hour for both? Raj, it can be done from June also. You need to look at PC. Second attempt, Rati, second attempt for which exam? Let me read your point. Expired until January 26. June. I think, Rati, I missed some of the points. SK written. I don't know. Just reframe the whole question. You failed written PCE and click on Saskatchewan. So we have to give the written exam. I mean, British Columbia is not a good idea to go with the clinical portion, and we have to rely on Ontario dates. If we get Ontario dates, then we can stay. Otherwise, if you're not getting, go with the new pattern. I'll say you can book the exam in October. You get to know if they're allowing Ontario exams beyond 2026. In new format, if one passes the written but not the oral. Yes, Isa, they need to go for the whole exam, because there's one passing for both. If you pass both, you pass. If you fail either of them, you fail. It's like that. And you'll be repeating the whole thing. And for CPT second attempt. That's fine, Rati. It can be done. I mean, you can start focusing on that. How long it's going to take for oral preparation? I think 2 months will be sufficient. 2 months, good amount of time will be sufficient. You don't need to study 8-10 hours. Oral section will be easy as long as your written is good. If your written is going to be bad, you won't be able to connect the dots for the oral. It says 150 points, not 150 questions. Is it 150 questions? All right, let me just quickly open that. I mean, it says total items / point. Total items means total 150 items. Items / points. So items means 150 items for that. PC written attempt when Saskatchewan. But I think that's fine. CPT can be done, but as I said, more preparation will be needed. All right, guys. Again, a lot of people have started preparing for the written portion. Written portion has to be very good. Your understanding has to be very clean for you to take the clinical portion or oral section if you're going for the new pattern. If you can take the exam this year, that's great. But again, a lot of things depend on Ontario, and a lot of things depend on other boards like Saskatchewan or other ones if they're allowing. If any of the boards can allow, they'll say it's a good idea to go there, get your registered license. If nothing is there, then you want to go with the new pattern, that's fine to go with the new pattern, but you should start your written preparation as soon as possible so we can be good with that and keep it aside. The written content is not going to go down in terms of teaching. Content has to be taught same, because same. And why it's important to know everything, because many of that can be asked in the oral section. So shoulder impingement or every shoulder condition, they may not ask everything in the written portion, but some of them can go in the oral section. If it goes in the oral section, you still need to know that in the written part, so that oral section we can just focus on questions like how will you decide if he is good for therapy? If you know the condition, you'll be able to decide. How will you decide if he's good for how will you take consent and or the treatment strategy, everything. So oral preparation will be more for questions, like combining everything you learned in written and explaining it in oral. You cannot learn anything new in oral. You'll have to just combine the written portion and be able to explain for the oral. And for that, your written foundation has to be extremely good. Can be done. I mean, the duration is not going to change. Content is not going to change or decrease for oral because syllabus is not changing for oral. Only addition will be here. Sorry, so it's not changing for written. Only addition will be oral. Okay. All right, guys, you have a great night. Reach out to us if you guys have more questions. Our email is pcsstudybuddy@gmail.com. I'm going to write it in the chat. Reach out to us if you have any questions, but start your preparation as soon as possible. Okay. All right, guys. Thank you again. Have a great night. Okay. Bye-bye.